Something remarkable is happening in the Lake Victoria Basin. Here, communities have realized their well-being is dependent on a vibrant ecosystem. And so, they have adopted an innovative strategy which integrates population, health, and environmental issues to restore and protect the integrity of Lake Victoria, the golden treasure shared among Uganda, Kenya, and Tanzania. To many, this strategy is popularly known as the PHE approach. The PHE approach empowers families within the Lake Victoria Basin to simultaneously demand and access voluntary family planning and sexual reproductive health services, while at the same time adopting cost-effective, affordable, and sustainable ways of managing the natural resources on which they depend, because they easily understand the interconnected relationship between their economic and cultural interests, both in the short and long term. The PHE approach was introduced as a pilot in 2011 under the Health of the People and Environment in Lake Victoria Basin project, also known as HOPE LVB. It is a regional project designed to reach across country borders to address the region's interrelated challenges. In Uganda, HOPE LVB is implemented by Pathfinder Uganda, an ecological Christian organization, ECO, on Busi and Zinga Islands in Wakiso district, and Jaguzi and Bonda Islands in Mayuge district. In Kenya, the project is implemented by Pathfinder Kenya and Oceanala, Friends of Lake Victoria in Suba, Ndiwa, and Rachuonyo North sub-counties in Homa Bay County.
And Kanyo Kaka Young Mother, Ebu HOPE LVB project. Kaka PHE.
I am a young mother working with the HOPE LVB. Before the project came, we had already produced 4 children, barely spaced by a year in between. The family was very poor. I and my children used to be very sickly. PHE has helped us a lot because we agreed with my husband to start planning for our family. That is why our 5th born came 3 years later. We are happy and we have been able to start farming. We now have enough food and surplus for sale. That is how we raised the money for starting this retail shop. And we are also trying to care for the environment. I have shared my experience, and already 2 of our neighbors are also considering to start family planning and to plant trees. So I can proudly say that I'm also a young champion.
None of these changes would have been possible without the commitment and creativity of the leaders and policymakers who supported the initial rollout of HOPE LVB activities and paved the way forward. PHE champions are advocates for an integrated approach to sustainable development. These champions, women and men, educate their fellow community members about the benefits of the PHE approach. Their strong communication skills allow them to raise awareness about PHE and to advocate for adopting the approaches in other communities. The PHE champions also adopt PHE activities in their own households and communities, becoming models for others.
We are working with 7 groups: the women group, the model household, the CW, the youths, the young mothers, and the farmers. Initially, we were only dealing with the health component, but after the intervention of PHE, we decided to integrate the three things: the population, health, and environment. So as a business lady, I'm running an M-Pesa. At the same time, I have a boutique. So as you know, many people are popping in. So in that, I have a good time in teaching my PHE to them. I'm happy because I have the knowledge and I'm sharing it with others.
A lot of people have accepted the use of EcoSan toilet because of this message. I count that as a milestone. And again, people are also embracing the use of the energy saving Jiko. And then people are also seeing the importance of now planting more trees because of this PHE integration. And I can't exactly tell where the boundary is between my day-to-day work as administrator and the work of advocating for PHE, because it has become part of my life to an extent that I talk about it in any gathering or I talk about it with anybody that can listen to me.
PHE champions also travel to other districts or counties to advocate for PHE. By sharing their knowledge and experience, they improve government officials' understanding of the benefits of the PHE in solving the interconnected development challenges. They can encourage the officials to adopt policies and laws that promote an integrated PHE approach and to consider ways to scale up PHE in their jurisdictions and beyond.
All heads of departments and sub-county chiefs and CDOs were actually trained using the capacity building grant to appreciate and understand the PHE model. And when they saw how the PHE model works, people picked interest to even form an association. We have a district PHE association, and it has actually a constitution. It has opened up accounts, and they want to see how best they can even roll over the PHE model to other places. This is a result of seeing that it's really a very good intervention. This time around, we think that with the support from local revenue, we shall be able to even add more other resources by integrating activities of PHE into departmental work plans as they go out to do activities.
This year's budget, the lion's share was taken by health department. And I'm sure the people involved will now have all what it takes to be able to give a clear message on population, on health, on environment issues, and how these three are interconnected and how they can improve on our productivity. And you know, this is automatic. If we solve the health issues of the population and environment, we increase productivity. We increase productivity, we increase revenue. We increase revenue, we can be able to again support. So we shall have a vicious cycle of prosperity. And we wrote a letter to His Excellency the President telling him about the success stories we are now having at the islands so that we can make this a pilot project and other districts can come and learn from us.
And that is just the start. PHE champions have advocated successfully to 1. Increase the stakeholders' understanding of the interconnectedness of issues responsible for the challenges facing the Lake Victoria Basin and its inhabitants, and the benefits of the PHE approach in solving them. 2. Increase the capacity of the key stakeholders to communicate about the PHE champions have advocated successfully provide platforms for policy dialogue and budget to influence regional and national stakeholders to integrate PHE into their programs. And 4. Raise the profile of the Hope LVB project.
Nothing is small in a project of this nature. So everything that has been done and the process that have been taken to reach the results that we have seen will be properly documented. And then every effort should be made to ensure that these are scaled up. If you pick, for example, the issue of zoning and demarcating those fish breeding areas, that's an area that, for example, eventually needs to be turned into a regulation or even a bylaw. And this information is going to help because we've seen how the communities have been able to participate in achieving this particular target here. And I think that this project is really a prototype of what we are trying to do at a global level. We are trying to bring in the people, we are trying to bring in their social fabric, but also we are looking at the environment. And I think it has demonstrated that it is possible to actually achieve the three aspects of sustainable development.
So the development strategy for the Ministry of Agriculture, it has thematic areas. One, we want to increase productivity and production. Number two, the thematic area is to provide critical inputs to the population. The third one is to promote value addition and market access. And the fourth one is strengthening the institution. So with this information, I'm going to make sure that the environment, population and health is touched at all levels of our strategic plan.
The challenges we now have in Uganda, like other partner states like Kenya, Rwanda, Burundi and Tanzania, is that since it is being pushed as a regional program, we need EAC to come up with PHE policy for the East African community. And once that policy is put in place, or a strategy, then the member states under East African community can also develop country-specific PHE policy. And once we have that in place, then the national institutions, including the line ministries, can take it up.
Kenya is the leader among the countries sharing the Lake Victoria resource in terms of promoting PHE. In Homa Bay County, the PHE initiative has been integrated within the different levels and structures of governance within the county. In addition, they now have a PHE steering committee at the county level with 17 members. But how did it all start?
The county PHE steering committee was constituted, was based on three anchors. One is enhancement of policy, because we want the county government also to get fully involved. And I'm glad that we are working towards that. Very soon we are going to support our members of the county assembly to pass a bill that's going to recognize PHE in this county.
This will actually regulate the activities and it will give direction on exact areas of need that benefits the community.
Once you have that in a policy, then now you can work through it because some funds will be allocated to it. When we talk about institutionalizing PSE, that we want all these departments, all these sectors within government, all these stakeholders to understand that these things interrelate. Now we can package them into a tool and anybody can talk about it. Somebody in environment can talk about reproductive health very nicely. Somebody in agriculture can talk about fishing very nicely, responsible fishing. And once they have that buy-in, it forms part and parcel of their core functions.
To actualize the process, the Homa Bay County Chief of Staff, a senior PHE champion, is giving full support to the process to change the worrying state of affairs of the people in the county.
The PHE intervention in this region was actually on a pilot basis. So those areas where the program was being piloted, there's there's positive outcomes that can be documented, that can be seen, but there's need for a serious scale-up of PHE in the region so that we can talk of outcomes at a larger scale. And for it to move to a larger scale will require strategic partnership with other development partners. But we have not really sat down waiting for development partners to come to really support. So currently we are using our locations, ministry and departmental locations, to integrate PHE into all the interventions. Even the performance contract that the county government will be signing in the next few weeks, we found all these PHE issues actually integrated in performance contracting. And part of the issues that we want to discuss with the committee in the subsequent meetings in terms of whether it will be feasible, programmatically right and sound to have a standalone budget for PHE.
PHE champions advocate at the national level too. As countries around the world consider how to set targets and meet goals to achieve the 17 new United Nations Sustainable Development Goals, PHE advocates encourage national governments to use the PHE approach to achieve multiple goals. For example, utilizing a multi-sectoral approach can help countries meet Sustainable Development Goals number 1, 2, 3, 5, 6, 10 and 15, which focus on poverty, hunger, health, gender, water, inequality and natural resources, and could even accelerate progress. PHE champions are also working with regional institutions to raise the profile of PHE and advocate for its adoption by regional and national governing bodies.
Lake Victoria Basin Commission is a center of excellence for PHE policy and programming. We want to see sustainable development that is anchored on improved livelihoods, improved health of the people, and improved environmental conservation practices. And that is what PHE is all about. We have a role to build capacity of different stakeholders at different levels, regional, national, subnational, up to community level, on what the PHE approach is all about and how PHE should be measured. In the Lake Victoria Basin, we have a number of environmental conservation projects and programs that are running, but they are being implemented vertically. So it is the role of the Lake Victoria Basin Commission to make sure that these projects have components of population and health integrated within them, so that there is value addition and so that the communities can see the interlinkages between population, health and environment, and also appreciate the value of approaching these challenges in an integrated manner.
If all of us embrace the PHE approach, Lake Victoria, its basin and the over 40 million people living within the riparian region will once again enjoy the benefits therein to the full, much sooner than later, and for generations to come. Your actions and creative thinking can make an enormous difference. Come and join us.